The monitor screamed before anyone did. Flatline. For a second, even the machines held their breath. The sterile air in the ICU seemed to thicken, heavy with antiseptic and disbelief. I felt my palms burning through the latex gloves, the kind of burn that comes from 35 minutes of chest compressions and a truth you don't want to fussy. Sarah's ribs had already cracked. I could feel them shift with every push. Yet, her fiancé at the foot of the bed, clutching a white veil like a man holding a promise the universe just revoked. "Doctor, please, don't stop," he whispered. His voice trembled, half command, half prayer. The nurse glanced at me. Sweat had turned a mask translucent. Time of death. She asked softly, as if afraid her words could summon guilt itself. But before I could answer, Ethan stepped forward, tears carving salt into his surgical mask. She was supposed to be my wife today. Can I just say the vows? Please. The ECG still drew its merciless straight line, cold and certain. Around us, the ICU lights hummed, and the smell of adrenaline lingered like electricity after lightning. I looked at the veil in his hand, then back at her still face. Medicine said stop. Humanity said wait. I closed my eyes for half a second. In that silence, I could still feel her pulse ghosting under my fingertips. Maybe memory, maybe denial. Either way, it was stronger than any guideline. "Go ahead," I heard myself say. And as he began to speak the words of a wedding that death had already interrupted, I couldn't help but remember the first time I met Sarah, 2 weeks ago. Walking out of surgery with laughter still stuck in her throat. 2 weeks earlier, Sarah walked into my OR, holding her own fear like a purse she didn't want anyone to notice. It was a Tuesday that felt like every other Tuesday in this hospital flu season, refusing to die. The edge spilling over into hallways, and my coffee going cold in the same spot on the counter because I never had time to drink it. The air in pre-op smelled like chlorhexidine and anxiety. Machines chirped their polite warnings. Nurses moved with that quiet speed that looks like calm until you recognize it as exhaustion in choreography. Sarah Whitaker. I called, flipping through her chart as if paper could soften what it contained. She lifted a hand. 28. No makeup, hair tied back too tightly, a hospital gown that made her look like she'd already surrendered something. Her fiancé stood beside her bed, tall, restless, holding her phone and her wedding binder like they were talismans. He had the kind of smile that tried to outrun reality. "I'm Dr. Mendes," I said, pulling the curtain closed behind me. The snap of the plastic rings sounded final. "You're here for an exploratory laparotomy." She swallowed. "That's the one where you go in and look, right?" I nodded. "We go in and we find the bleeding. We stop it." I kept my voice steady. The way he trained to calm is part medicine, part performance. "The CT suggests a splenic laceration. Your blood pressure's been dropping." "We don't have the luxury of waiting." Ethan leaned forward. "She's getting married next month," he blurted. Like the body would listen if he said it loud enough. Sarah shot him a look, half affection, half warning. "Ethan." He softened instantly. "Sorry, I just..." "She can't, she can." I cut in gently, because I'd learned over the years that families hear what you don't say more than what you do. Right now, the plan is to keep her alive through the next hour. That's the job. Sarah's eyes stayed on mine. And after the hour, it wasn't a dramatic question. It was a practical one, the way patients sometimes ask when they're too scared to decorate the fear with anything fancy. I took a breath. The monitor in the corner ticked out her tachycardia like a metronome. After the hour, I said, "We'll see what kind of bleeding you have and whether there's anything else injured. People do recover from this, but surgery isn't a promise." She nodded once, like she'd filed that away. Then, unexpectedly, she smiled. "Okay." She turned her head slightly toward Ethan. "Hey, if I wake up with a scar..." You're not allowed to act like you don't like it. Ethan laughed one sharp, relieved sound that didn't belong in that room. I'm going to love it. I'm going to love every part of you. Scar or no scar, the anesthesiologist stepped in, checking Mendes, checking Chimmy, checking the way we all check everything when we can't check the one thing that matters. I watched Sarah's fingers twist the edge of a blanket, small movements that betrayed the courage she was trying to wear. Any allergies? I asked. Penicillin, she said. Okay, I tapped it into the chart. Any medical problems? Anything we need to know? She hesitated, eyes flicking to Ethan, then back to me. I faint when I see blood, she admitted, which is ironic. Ethan squeezed her hand. She also cries at dog commercials. Sarah rolled her eyes. Those dogs are abandoned. Ethan, that's not a joke. For a moment, the room had the shape of normal life. Teasing. Tenderness. The kind of conversation that says we belong to each other. Then the gurney arrived, and the illusion cracked open. As we wheeled her down the hallway, the ceiling tiles passed overhead like a slow film reel. The ICU doors opened and closed in the distance, spilling out the rhythm of ventilators and alarms. You could feel the hospital's nervous system humming every beep a signal, every footstep another attempt to keep someone anchored to the living. In the OR, my hands did what they always do. I opened. I searched. I found the bleeding. The spleen was shredded in a way that told the story of impact. Violent, sudden, unfair. We packed. We clamped. We cauterized. We transfused. We worked inside her body like engineers repairing a bridge in a storm. She made it off the table. In recovery, she opened her eyes for a few seconds, just long enough to find Ethan at her bedside. Her voice came out dry, raspy. Did you keep my ring safe? Ethan laughed again, trembling this time. It's right here. He pulled it from his pocket like a magic trick. Sarah blinked hard, and a tear slid sideways into her hairline. Don't lose it, she whispered. If you lose it, I'll haunt you. You can haunt me, he said, leaning down. But you're going to marry me first. I watched the exchange from the doorway, my hand still smelling faintly of betadine even after scrubbing. It wasn't my moment, but it still landed in me like a weight. I'd seen families in crisis 1,000 times. Most of them broke. These two, they held. Later that night, a nurse caught me at the station. Your splenectomy patient's asking for you, she said, flipping through her clipboard. I walked back in. Sarah looked smaller under the blanket, paler, but alive, the most complicated word we use. The one that people think is binary when it's anything but Dr. Mendes, she said. Her voice was thin, but her eyes were clear. I know you're busy, but can I ask you something kind of weird? Try me. She glanced at Ethan, who had fallen asleep in a chair, still holding her hand. If something happens to me, she said quietly, I don't want to be a project. I don't want to be kept alive just because no one wants to feel like they failed. The words hung between us, heavy and sharp. I felt my throat tighten. In the US, we talk about autonomy like it's a form you sign. We talk about code status like it's a checkbox. But what she was describing wasn't paperwork. It was dignity. You mean resuscitation? I asked, keeping my voice low. She nodded. If it's real, fight for me. If it's just breaking my body for an extra hour that I'll never feel, she swallowed. Then let me go like a human. I wanted to tell her she didn't have to think about that. I wanted to pretend we live in a world where love is enough to keep hearts beating. Instead, I pulled a chair closer. Have you talked about an advance directive? I asked. A health care proxy who would make decisions if you couldn't? She looked at Ethan. Even asleep, he seemed braced, like some part of him never stopped standing guard. Him, she said. It's him. Then we should document it, I said. And we should talk about what you want. Clearly. So no one has to guess. Sarah nodded once, relieved like naming the fear made it smaller. 2 weeks later, the call came in like a punch. Motor vehicle collision, high speed, prolonged extrication, hypertensive en route. A young woman with massive trauma. She'd been wearing a ring. By the time they rolled her into my ICU, the antiseptic smell hit me first, then the blood. Her face was swollen, bruised, almost unrecognizable except for the curve of her mouth, and the way Ethan's voice broke when he said her name. And now my hands were on her chest again, compressing a body that had already asked me not to become a project. The ECG had drawn its final line. The ventilator hissed like a tide pulling back. Ethan held a veil in his fist, as if fabric could rewrite physiology. In the present, my nurse's eyes met mine over the bed. She didn't need to speak. We both knew what the guidelines allow when there's no reasonable chance of benefit. Resuscitation can be ethically foregone, and when further CPR is medically non-beneficial. It should not be offered just to satisfy the feeling of doing something. But then Ethan's voice sliced through the IQ noise, raw and shaking. "Please," he said. Let her hear me, and the past Sarah's quiet request. Her definition of dignity clamped around my wrist like a pulse I couldn't ignore. The ICU doesn't erupt when someone dies. It tightens. The moment Sarah rolled through the doors, the unit seemed to shrink around her gurney. The air was colder than the hallways, recycled, overconditioned, smelling of bleach wipes and warmed plastic from ventilator circuits. The trauma team's voices overlapped in clipped fragments. A language built for speed. To large bore IVS. Pressure 60, systolic, pelvis unstable, fast positive. Let's get blood running. The monitors translated. Panic into numbers and then into alarms. Ethan arrived half a heartbeat behind her, escorted by security because he refused to be separated from the only person in the building who mattered to him. His hair was wet rain or sweat, I couldn't tell, and his hands kept opening and closing, as if his body was trying to remember how to hold something without breaking it. She was talking, he said, to no one and everyone. She was talking to me in the ambulance. That line, "she was talking," is the sound of hope misreading medicine. Sarah's eyes were open but unfocused, pupils sluggish, face mottled with bruising. There was blood at her hairline, and the collar of her trauma gown was already damp and rust-colored. Every breath was shallow, as if her chest had forgotten the full shape of air. I touched her shoulder and leaned in close. "Sarah, it's Dr. Mendes," I said. "Can you hear me?" Her lips moved. No sound. The nurse hung the first unit of O-negative with the calm of ritual. The bag looked almost black under fluorescent light. Someone cut away her clothes. Someone placed a warming blanket that puffed with forced air. Because trauma patients don't just bleed, they freeze. And freezing makes clotting a myth. BP dropping, the resident called. "I need a pulse check," I said. My fingers found the carotid thin, fluttering, uncertain, like a bird trapped in a closing fist. "Get me a rapid infuser," I ordered. Massive transfusion protocol. Now, we weren't in a TV version of an ICU where the lighting flatters and everyone has time for full sentences. This was the real one. Plastic curtains, harsh LEDs, and the constant background symphony of beeps, each tone a different kind of warning. And then her heart rhythm did that subtle shift you learn to dread. The rate slowed. The complexes widened. The line began to lose its arguments with gravity. "V-fib," someone said. The monitor stuttered, then erupted into chaos-jagged waves that meant the heart was still moving, but not in any way that counted. "Charging," the nurse announced, hands already on the paddles. "Clear," I said, bodies pulled back. The smell of alcohol wipes and fear. The shock hit her like a silent lightning strike. Her chest jumped. For a fraction of a second, everyone believed. Then the rhythm collapsed into a systole flatline, the cruelest simplicity. Start compressions. I said. I climbed onto the stool, placed the heel of my hand on the center of her sternum, and began. Down, up, down, up. The bed rocked in tiny increments with each push. Her skin was cold, slick with sweat and blood, and the cracking came early, the unmistakable give of ribs surrendering. If you've never done CPR, you imagine it as heroic. In reality, it's controlled violence performed with desperate precision. 1 milligram epinephrine, I called out. Every 3 to 5 minutes, the nurse pushed the drug, and in my mind I watched it travel through plastic tubing into vein, toward a heart that no longer cared about chemistry. Epinephrine is our prayer in liquid form. It squeezes vessels, tries to force blood into a brain that's starving. Airway, I asked. Bagging, respiratory therapy said. Mask sealed tight. Get ready to intubate, I said. I want a tube. The laryngoscope clicked on. The blade went in. Teeth guarded by bite block. Vocal cords, pale and wet. The endotracheal tube slid through with the smoothness of practice. Breath became mechanical. The hiss of oxygen, the rise and fall that mimicked life without guaranteeing it. A nurse leaned in, voice low at my ear. Family's here. I didn't look up. I couldn't. Not yet. Where? I asked anyway. Right outside the glass, she said. He's losing it. On the other side of the door. Ethan was visible through the panel window, his forehead pressed to the glass like he could warm her back to staying. His mouth moved. I couldn't hear the words, but I recognized the shape of begging. Pulse check, I said. We paused, compressions for 2 seconds and eternity, a compromise between circulation and certainty. My fingers found nothing. Resume, I said. Minutes passed in the strange, elastic way they do during a code. The room had its own weather, the heat of bodies, the chill of the air conditioning, the metallic smell of blood, the sharp bite of antiseptic. Sweat gathered under my gown and rolled down my spine like guilt. Rhythm, the resident asked. Asystole, the monitor answered before anyone did. I watched the nurse's hands. I watched the resident's jaw tighten. I watched respiratory's eyes flick to the clock. Everyone was doing math. Time without a pulse, time without oxygen, time without a miracle. Ethan suddenly forced his way through the door when someone opened it for a runner. No, 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 he shouted, stumbling into the room, stopping short when he saw Sarah's body jolting under my hands. His face changed as he witnessed CPR up close, the way a person's face changes when fantasy meets physics. A social worker caught him by the elbow. Sir, you can't be in here. I'm not leaving her, he snapped, voice cracking. I'm not, please. Our nurse, Maya, stepped between him and the bed with a calm that had cost her years to earn. Ethan, she said, we're doing everything we can. He looked at Mimi specifically like I was the one holding the universe's off switch. Dr. Mendes, he pleaded. You said you'd fight. I kept compressing, down, up, down, up. My shoulders screamed. My wrists ached. The weight of my stethoscope bounced against my chest, absurdly intimate. We are fighting, I said, and it was both truth and a lie. Because in the back of my mind, Sarah's earlier words were a second monitor. If it's just breaking my for extra hour that Ellie never feel, lemon. Another round of epi, the resident said. The nurse pushed it, again, like feeding lightning into a dead sky. And then Ethan did something I didn't expect. He reached into his jacket and pulled out a small, crushed box. A hingi box. The velvet was stained at one corner. We were supposed to get married, he said, voice suddenly quieter. Almost conversational, like he was talking to Sarah across a dinner table and not across a chasm. She wanted it simple. His eyes flicked to Maya, then to me. Can we do it here, right now? I have a friend who's a pastor. He's downstairs. Please, please, just let her hear me. The resident stared at me, waiting for the medical answer. Maya stared at me, waiting for the human one. And the monitor kept its flat, unwavering line, insisting there was only one kind of truth in this room. I called for another pulse check. Nothing. Time. The resident asked softly, pen poised like a blade. I looked at Sarah, at the bruises blooming across her skin, at the tube between her lips, at the compressions deforming her chest, at the indignity we inflict in the name of benefit beneficence, wrestling non-maleficence, in a room that smells like bleach and endings. Ethan held the veil against his chest now, as if it could stop his heart from breaking. Just let me say I do, he whispered, even if she can't answer. Even if it's only for her soul. My hands hovered over Sarah's sternum, trembling from effort, from fatigue, from the terrible freedom of being the one who gets to decide when to stop. Doctor, Maya murmured, barely audible. What are we doing? And that question, what are we doing, hit harder than any alarm. My hands stayed suspended above Sarah's chest for a fraction too long enough for the room to notice. Not long enough to call it a decision. The resident's pen hovered over the chart. Maya's eyes didn't blink. Respiratory stood at the head of the bed, one hand steadying the tube, the other resting on the ambu bag like a trigger. And Ethan held that veil to his sternum as if pressure could stop grief from hemorrhaging. Resume compressions, the resident said, not as an order, but as a reflex. The algorithm speaking through him. I could have complied. I should have. That's the thing about protocols. When you follow them, no one can accuse you of making it personal. But Sarah was personal now. I dropped my hands back onto her sternum. Down, up, down, up. The bed rocked. Her skin dimples under pressure, then springs back like it's trying to remember what it was before all of this. Each compression was a question I couldn't say out loud. Is this help or is this harm? Epitimer's up, Maya said quietly, glancing at the clock. Give it, the resident replied automatically. I heard the syringe depress. I imagined the medication rushing into a circulation we were faking with brute force. In med school, they teach you how to run a code. They don't teach you what it feels like to be the one who has to decide when a life stops being a rescue and becomes a ritual. Ethan stepped closer, blocked by Maya's shoulder. Doctor, his voice cracked and then flattened into something almost controlled. Like he'd run out of screaming and was forced into whispering. She can still hear, right? People can hear, even when they're like that. I kept compressing. My arms were shaking now, fatigue blooming from the core of my shoulders. Sometimes, I said. It was the only honest answer I could give without making a promise I couldn't keep. But she's intubated, Ethan pressed, eyes glassy. She can't talk back. No, and if she did hear him, she couldn't tell us. That's what makes the last moments so cruel. Communication becomes a one-way street. Maya leaned toward me, voice barely audible under the alarms. He says he has a pastor downstairs. The resident's eyes snapped to mine. We can't run a wedding in the middle of a code. He wasn't wrong. Codes are not private, not romantic, not dignified. Their bodies and bruises and fluorescent light. They're a team doing synchronized violence because the alternative is a silence that feels like failure. Doctor, the resident continued, louder, the way people get when they hear afraid they losing the room. We have no shockable rhythm, asystole for 20 minutes. This is futile, futile. That word always arrives with an edge. It's supposed to be clinical, but it lands like judgment, not worth it, not going to work. Stop wasting effort. Ethan heard it anyway. No, he snapped, stepping forward again. Don't say that. She's not futile. She's Sarah. Maya held him gently but firmly. Ethan, please. I watched Sarah's chest rise with the ventilator's rhythm forced, obedient, impersonal. I watched her lashes tremble with each compression. like a tiny reflex from a body that didn't get a vote. And then something flashed in my mind. Sarah in recovery, 2 weeks ago, voice thin but clear. If it's real, fight for me. If it's just breaking mighty overfeel, then let me go like a human. It hadn't been a signed DNR. It wasn't legally clean. It was something harder, a request spoken in trust, filed not in a chart, but in me. Did she ever talk about what she would want? I asked Ethan, still compressing. Ethan froze like I'd hit him. What? What would Sarah want? I repeated. If she could answer right now. His eyes darted to Sarah's face, then to the tube, then to my hands crushing her chest. A sob climbed up his throat and got stuck. He swallowed, trying to pull words through panic. She said she didn't want to be kept alive. Like a vegetable, his voice broke on the last word, and he looked ashamed, like he'd betrayed her by saying it aloud. The resident exhaled sharply. That's not a DNR. I know, I said. Maya's hand touched my forearm for a second brief contact, a nurse's way of saying I see you carrying this. The resident leaned in. If we stop, we're stopping. There's no pause for vows. He was right again. In codes, you don't get to negotiate with time. Once you call it, the room changes. The energy drains. The team dissolves into quiet tasks, removing lines, labeling belongings, turning off alarms. Death has bureaucracy. Ethan's voice dropped to a whisper. I just need her to hear me say it. I need her to know I didn't leave her alone. I felt my throat tighten. The ethical rules we quote in meetings suddenly felt too small for this moment. Autonomy, beneficence, non-maleficence. Justice words that make sense on paper but bleed at the edges in real rooms with real people. My arms were failing. My hands were slipping. And Sarah's ribs got her ribs, were already telling me what my conscience didn't want to admit. CPR is not gentle. It is not dignified. It is not love. It is math. And the math was turning against us. Switch compressors, I said, and slid off the stool before my form degraded into desperation. The resident took over, jaw clenched, compressions sharp and fast. I stepped back, finally able to see the full picture. A young woman being battered by our attempt to keep her from disappearing. A fiancé holding a veil like a flag. A team watching me, waiting for the attending to name the truth. I motioned Maya closer. Get the pasta, I said under my breath. Her eyes widened. Doctor, get him, I repeated. Now, but quietly. And tell him he has 90 seconds. The resident stopped compressing for half a beat, startled. What are you doing? I leaned in, voice low, steady in the way you have to be when everyone else is unraveling. I'm deciding whether this is medicine or punishment. His eyes flashed anger, fear, disbelief. We're obligated to do CPR. We're obligated to do what benefits the patient, I said. Not what protects our discomfort. Ethan heard enough to understand something was shifting. He stepped closer, shaking. Doctor, please. I looked at Sarah's face. I tried to imagine what she would choose if she could rise up through sedation, through shock, through trauma, and speak one sentence to all of us. Then I heard my own voice in my head. From 2 weeks ago, surgery isn't a promise. Neither is resuscitation. I raised my hand slightly, the universal signal in a code, the one that makes hearts in the room stop before the patient's does. After the next pulse check, I said, we're going to make a choice. And for the first time since Sarah arrived. The room went still enough to hear Ethan's breathing ragged, desperate like he was trying to inhale an entire future before it vanished. Pulse check. The resident's hands lifted from Sarah's chest like they were breaking contact with something sacred. The ventilator continued its measured hiss, indifferent. The flatline held steady, no flicker, no mercy, just that clean, endless horizon. I placed 2 fingers on her carotid again, pressing gently as if softness could coax a miracle. Nothing. Still asystole, the resident said, voice tight. Maya looked at the clock. Her eyes were wet, but her hands didn't shake. That was the thing about ICU nurses. They carry other people's endings with a steadiness that would crush most of us. The door opened and the pastor slipped in out of breath, hair damp, collar crooked. He froze for half a second when he saw the scene, the bed crowded with bodies, the crash cart open like a mouth, the tubing, the lines. The bruises blooming under fluorescent light. "I'm sorry," he whispered, like an apology for arriving to a war instead of a wedding. Ethan stepped toward him and nearly fell into his arms. "Please, please just do it." The resident turned to me, voice low, urgent. "Doctor, we can't stop without calling it." I stared at Sarah's face. The tube held her mouth open in a way that felt obscene. Tape pulled at her cheeks. Her hair was matted with dried blood. The warmth blanket-puffed air around her body like a costume of comfort. I heard Sarah, again 2 weeks ago, her voice thin but unflinching, "Don't make me a project. A code is a place where autonomy goes to die if you let it. A body becomes a platform for our need to prove we tried." I lifted my head and met Ethan's eyes. He wasn't asking me to save her anymore. He was asking me to let her belong to him one last time. "Maya," I said quietly. "Yes, doctor. Stop compressions." The resident's jaw clenched. "Dr. Mendes." I raised my hand without looking at him, the signal that ends debates. "Stop." Silence crashed into the room. Not total silence, machines still hummed. Oxygen still flowed, but the violence stopped. Sarah's chest no longer buckled under hands. Her body lay still, finally allowed to be a body and not a battlefield. The monitor continued its flatline, but now it felt less like an alarm and more like a sentence already served. Time of death. The resident began automatically, pen poised. "Not yet," I said. His eyes widened. "What?" I took a breath I could feel all the way down to my ribs. "Document that resuscitation efforts are being terminated," I said, careful with every word. "But give me 1 minute before you write the time." Maya stared at me, understanding instantly. She reached up and gently, reverently silenced the alarm. The ICU didn't become peaceful, but it stopped screaming. Ethan stepped to Sarah's bedside so fast he almost tripped over a cable. He took her hand, his fingers brushing over the tape, the IV, the bruising. He flinched at the coldness, then held tighter as if his grip could transmit heat into eternity. "I'm here," he whispered. "I'm here, I'm here, I'm here." The pastor cleared his throat, eyes flicking from the tube to the veil to the staff in the room like he was trying to find the right doorway into the moment. He stopped, voice breaking. He swallowed. "We are gathered in a place none of us expected." Ethan nodded furiously, tears slipping under his mask. Just say it, please." The pastor's hands trembled as he opened a small book he didn't really need. "Ethan," he said, voice soft but steadying. "Do you take Sarah?" Ethan leaned close to Sarah's ear, so close his forehead nearly touched hers. "Hey," he breathed, like he was waking her from a nap. "It's me." His voice changed, then less desperate, more intimate, as if he refused to let the ICU steal the tone of his life's most important words. "I was supposed to see you in a dress," he whispered. "Not like this. But you're still you. You're still the girl who made fun of my dancing and cried at dog commercials." A broken laugh slipped out of Maya. It sounded like grief, trying on humor and failing. Ethan kept going anyway. "I promise you," he said, voice shaking, "I'm going to love you the way you deserve. I'm going to take care of your mom. I'm going to keep your ring safe, God. I'm going to keep it safe. And I'm going to live in a way that would make you roll your eyes and smile at the same time." He paused, swallowing hard. "I do," he whispered. "I do. I do." The pastor looked at me, silently asking permission for the last step like I was some gatekeeper between sacred and clinical. Go ahead, I said. Sarah, the pastor said, voice breaking on her name, if you can hear us, you are loved. And in the eyes of God, love is not delayed by walls or machines. Ethan pressed his lips to Sarah's knuckles careful, like she might bruise from the tenderness alone. You're my wife, he whispered. Okay, you're my wife. For a moment, the room held still around them. The staff didn't move. No one checked a monitor. No one adjusted a drip. It was as if the whole ICU made space for one human wish to land. Then Sarah's body did what bodies do at the end. A final, involuntary breath in, reflexive. The nervous system's last echo. Not a miracle, not a return. Just a closing. Ethan felt it and went rigid. She, he stammered, eyes wide. She heard me. She heard me. I didn't correct him. Not then, not in that minute. Because what he needed wasn't physiology. It was meaning. Maya's hand went to Ethan's shoulder. She wasn't alone, she said. I nodded toward the resident. Now, I said gently. He looked down at the chart like it weighed 1,000 pounds. Time of death, 3:17, he said, voice barely audible. The words fell into the room and stayed there. Ethan didn't scream. He didn't collapse. He just held Sarah's hand and rocked slightly, as if his body could soothe itself the way you soothe a child after a nightmare. I stared at Sarah's chest still, bruised, finally untouched. And I felt the sharp, ugly paradox of medicine. We can extend life, but we can't extend love. Not in hours or heartbeats. Only in moments. And for 1 minute, we had chosen the moment. 3 days later, I found the veil. It was folded inside a clear plastic belongings bag, the kind we use when we don't want to say the word dead out loud. Someone had labeled it in black marker Whitaker, Sarah, and underneath, in smaller letters, ICU. The bag sat in the charge nurse's office, beside a stack of discharge paperwork and a half-eaten granola bar. As if Sarah's last symbol belonged to the same category as forms and forgotten snacks. I stood there longer than I meant to, staring at the fabric through the plastic. The hospital had already moved on. Always dois. New patients had filled the beds. New alarms had replaced the old ones. New families had arrived with their own version of the same terrified eyes. But my hands remembered her ribs. Not in a dramatic way, in a tactile way. Like the nervous system keeps receipts the mind doesn't ask for. When I opened a door, my palms flashed with phantom heat. When I pressed down on a patient's abdomen during rounds, my wrists tightened, anticipating resistance that wasn't there. Even washing my hands felt different, like I was trying to scrub off a decision, not bacteria. I'd been called into a meeting that morning. Not a courtroom, not an interrogation, something worse. A conference room with lukewarm coffee and a circle of chairs that made grief look procedural. Risk management. Nationalidade Pública. A resident educator. People who weren't in the room during the code, but would carry responsibility for it anyway. They asked me to walk them through the event. That phrase, walk us through, made it sound like we'd taken a scenic route. I described the timeline, the trauma, the prolonged asystole, the lack of response, the increasing harm of compressions. I used words that stayed clean in the air. Medical non-benefit, diminishing returns. Termination of efforts. I watched them nod when the language fit their frameworks. Then someone asked, carefully, and the ceremony, the wedding, in their mouths, became the ceremony, a deviation, a risk. A headline they could already imagine. I looked at the table, at the notes, at the way everyone avoided saying her name like it might make things messy. It wasn't a ceremony, I said. My voice quieter it landed. It was a patient's last human moment. And it wasn't incompatible with good medical care, it was the point of it. The ethics rep leaned forward. Did she have an advance directive? No, I said. Any documented DNR? No. Then what informed your decision? I didn't reach for something noble. I didn't say I followed my heart. That would have made it easier for them to dismiss me. I said the truth. She told me, I replied. 2 weeks earlier. She said she didn't want to be kept alive just so no one would feel like they failed. The room went still. And for the first time since that night, I felt the full weight of what I'd done, not just stopping CPR, but choosing how to stop. Choosing to let a man speak vows into a dying silence. Choosing to allow meaning to exist in a space designed for medicine, not poetry. They asked if I'd do anything differently. I thought about Sarah's chest under my hands, about Ethan's eyes, about the pastor's trembling voice, about Maya silencing the alarms like she was lowering a flag. No, I said. I'd do it again. That was when I realized the scar wasn't going to be made of guilt. It was going to be made of clarity. Later, on my way back from the meeting, I walked past the ICU waiting room. The vending machines glowed. The chairs were filled with people holding phones they weren't really looking at. A child slept with his head on a woman's lap. Someone laughed too loudly at something on a screen, trying to prove they were still normal. And there, near the corner by the water fountain, Ethan stood alone. He looked thinner, like grief had already started consuming him from the inside out. He wore the same jacket, the same ring now, on a chain around his neck, tucked under his shirt. He didn't see me at first. Then he did, and his face shifted into something complicated: pain, gratitude, anger, all braided together. "Dr. Mendes," he said. "Ethan." My throat tightened. "How are you holding up?" He hinted once, a sound that almost gave, "But I know what I'm doing," he admitted. I wake up and for half a second I forget. Then I remember, and it's like falling downstairs, over and over. I nodded because there was nothing else to do with a confession that honest. He stared at the floor, then lifted his eyes to mine. "People keep telling me you did everything you could," he said. Like that's supposed to fix it. I didn't defend myself. I didn't offer platitudes. I waited. Ethan's jaw flexed. "But thank you," he said, voice breaking, "for letting me be her husband, even for a minute. The minute. In medicine, a minute is a unit of time. In grief, it's a lifetime you replay until your brain wears a groove into it. I didn't give you that," I said quietly. "She did." She made her wish clear. I just listened. Ethan nodded, swallowing. His fingers brushed the chain at his neck. "I keep thinking," he said. "Maybe she heard me. Maybe not." "But she wasn't alone." "No," I said. "She wasn't." He held my gaze for a beat longer, then turned as if the conversation had cost him more than he could afford. He walked away down the hallway, past the ICU doors, past the monitors and the antiseptic, carrying his new title husband like both a blessing and a wound. When he disappeared around the corner, I stood there and listened to the hospital. The beeps were still there. The footsteps, the intercom, the hum of machines doing their tireless imitation of certainty. Everything sounded the same. But I didn't. That case left me with a scar I can't show on my hands. The understanding that saving a life isn't always the most humane thing we can do, and that sometimes the bravest medicine is knowing when to stop fighting the body so the person can be honored. Since Sarah, I paused before every code. Just a half second. Long enough to remember that the heart is an organ, yes, but it's also a story. And when the story ends, what matters most isn't whether we followed every step perfectly. It's whether, in the middle of our protocols and alarms, we still made room for love to say what it needed to say.